Hello and welcome everyone. It's 9 a.m. My name is Amita. I'm co-founder of Nourish Doc. We offer preventive and holistic medicine that are backed by research, science, and successful. We present free webinars every Saturday morning at 9 a.m. Pacific Standard Time. Please note that this webinar is only for educational purpose. To present this, we have two very distinguished speakers today. Let me introduce Professor E. Sharma, Professor E. Sharma has done a lot of clinical trials on diabetes as well as other ailments. He has thousands of people to manage diabetes success. Next, we have Dr. Guru Datta, who has over 20 years of experience as naturopathic doctor and yoga instructor. Dr. Datta offers yoga classes to manage diabetes. Please note that we have exhaustive information today from these speakers. So if you have a question during the webinar, please use chat functionality and we will take it as we go along because we want to make this as an interactive session. So with this, I will have Dr. Ish start.
Hi, good day friends. I am Professor Ish Sharma and we are here with a very relevant and very important topic, that is natural Ayurveda and yoga tips to manage your diabetes with the special reference to your immunity. Because it is COVID-19 times, it is never before disastrous time where immunity counts the most. And let's continue. I'll be covering a few topics, and those topics will be: what is a virus, what is coronavirus, and what is COVID-19, an introduction to Ayurveda. I believe most of you who are here are well versed with Ayurveda, or at least are introduced to Ayurveda. That is why you are here. So I'll not be going to two basic principles. I'll just be brushing through them, and we move on to what is diabetes as per Ayurveda, what is immunity as per Ayurveda, what causes diabetes, and how can we prevent and treat diabetes, and how can we improve our immunity. These will be the subtopics. So let's start with the first topic. What is a virus and what is COVID-19? As you all very well know, the world is reading virus like anything. This is the most searched word on Google these days. Corona and virus and COVID-19. As you all could very well be aware by now, virus is neither living nor dead. And that is why we don't have any effective medicine from the Western medicine, which can be like genuine antiviral. We have got very genuine antibacterial medicines, antifungal are there, antiprotozoals are there, but we really do not have very potent, very short antiviral medicine. They, sometimes they work, sometimes they don't. That is why it is a pure grace of the virus, If that is fatal, then we have to surrender, like maybe polio or HIV or hepatitis or rabies. Or if the wilder is milder, like some flu virus, which normally they don't kill, they are kinder, then we are fortunate. Now, are viruses of some utility or not? Like bacteria, we have got many very useful bacteria. Are viruses also of some utility to mankind or not? Yes. Before the discovery of antibiotics, viruses were the main antibiotic tool, because bacteria can be destroyed. Bacteria can be eaten by a special class of viruses called bacteriophage. So many bacteriophage viruses were developed to work as antibiotic. Later on, we had wonderful antibiotics, and that line stopped there. Secondly, viruses are very helpful in horizontal transfer of genes in our body. They are regularly transferring the genes, and that is how these have got two useful functions. And all other what they do are harmful only. Viruses have been with the human beings since inception, since the human beings evolved. Viruses have always been there, and coronaviruses are known since 1960. They did not change form much, and that is why they were known by one name only, coronavirus. Now, for the first time, we had such a massive kind of a strain, such a transformation, where the new term was to be coined. That is what we know as coronavirus 2, which is an RNA kind of virus. Viruses can be RNA or DNA virus. You know very well. This is a RNA kind of virus, which is a small virus, like maybe 140 nanometer is the size, and this has got a very special feature. It causes a new disease known as COVID-19. This causes a very atypical viral pneumonia, primarily. What is viral pneumonia? Viral pneumonia will always be a dry kind of pneumonia where there will not be any productive cough. And these viruses are also believed to cause endothelial inflammation. That is why multiple organ failure can also ensue, which leads to lung failure, kidney failure, liver failure, and multiple organ failure, which can lead to death also. Now, when the virus enters our body, where does it go first? This goes to a class of cells which will be in receptors called ACE2 receptors, angiotensin converting enzyme 2 receptors, and those are abundant on almost every cell, and those are the most abundant on the alveolar cells of the lungs. That is why lungs the most damaged. And when it comes to detection, then you have to know that from the day zero, when you just have the virus in, the most confirmatory test will be reverse transcription polymer chain reaction. RT-PCR is the most confirmatory test, which comes positive on day zero, to be staying positive normally up to day 20. This is taken from a nasal swab. And the other two tests which are used to tests, which are like the IgM, which turns positive on day 7 up to 21, and IgG, which as a rule turns on later, maybe from day 14 to day 28. These are the investigations, lab investigations. If the patient is having the lung damage, then it will be leading to lung fibrosis. So this leads to viral pneumonia with endothelial inflammation and lung fibrosis. That is where we finish with the introduction to virus, and we'll be moving on to introduction to Ayurveda and basic principles. Maybe we can take up some questions, Amitaji, if they are there. Come to Ayurveda. So maybe did Ayurveda, because we are talking about COVID-19 and diabetes and Ayurveda, did Ayurveda know about viruses? Yes, Ayurveda did not call them viruses, or Ayurveda did not call them bacteria. Ayurveda called them Sukshma Krimi and Bhoot. These were the terms used by Ayurveda to describe these invisible enemies. Ayurveda very clearly told there are some very small microbes which cannot be seen with the naked eyes. They are too small to be seen, and they are transferred upon physical contacts. When you talk, touch, eat together, hug, sleep together, when you walk together, that is how they transfer from one person to another and lead to many contagious kind of problems, many contagious diseases. And the first disease Sushruta told was conjunctivitis. Flu-like situations could be there from this kind of microbe transfer from person to person. That is where social distancing was very well advised by Sushruta, because you have to prevent the causative factors. You have to prevent this crowding. Social distancing is the first step to avoid these microbial spread. Such contagion can be only prevented through physical contact inhibition. Now we come to the basic principles of Ayurveda. Will not be going into much detail, because basic principles form altogether a different subject and could be too long to be taken over here in detail. So Panch Mahabhuta is the first basic principle of Ayurveda, which is the Ayurveda anatomy. We can simplify in that language. Panch Mahabhuta are the 5 general elements. This is Ayurveda anatomy. Then those 5 Mahabhutas produce Tridosha, Vata, Pitta, Kapha, which is the physiology of the human body. And these all evolve from Triguna, Sattva, Raja, Tama, which is the mind quality. Sattva, Raja, Tama are the mind quality. What should we be doing? What is correct to do is determined by Sattva. How to do it is Raja. And when to stop, the controller is Tama. So all three are very important. Then we come to another very important basic principle of Ayurveda, that is Prakriti, your individual body type. Like your fingerprints, your body type is very individual. No two individuals are the same. And that is where Ayurveda physician will be routing through your Prakriti analysis, your constitution analysis. Will take an hour to make out what your Prakriti is. Are you a Vata type, a Pitta type, or Kapha type? We have got a questionnaire. We check your pulse, and that is how we reach to a conclusion. Accordingly, we make some suggestions to you, like what you should be eating, where are you more at risk to have some particular kind of diseases, what your diet habit should be, what your profession should be. That is what we can make from your Prakriti analysis. Then we have got a very strong forte from Ayurveda, that is preventive medicine. Your Tridosha balance, your Agni balance, seasonal and your daily routine, urges, natural urges, you should not be withholding natural urges, meditation, yoga, exercise, these form very strong preventive medicine by Ayurveda, coupled with a few herbs which you should be taking every day as a rasayana so that you don't fall ill in first place. Then we have got a very special phytotherapeutics, that is healing herbs. What are the herbs that heal? What are the herbs that boost your immunity, or what are the herbs that control or regulate your blood sugar? That we'll be talking about. And then last, very powerful tool from Ayurveda is Panchakarma detox. How to use it, how to use it to detox, how to use Panchakarma to boost your immunity, how to use Panchakarma to control or manage or prevent your diabetes. These are the basic principles which we'll not be detailing anymore. Maybe if we have got some questions coming up, Amitaji, we can take up. Now, very interestingly, Ayurveda is believed to be on a conservative side, maybe 2000 years old, and by other historians, this could be as old as 50,000 years. So it ranges between 2000 to 50,000 years old. And the modern science has been knowing diabetes for the last 800 years. Very interestingly, Ayurveda called diabetes as Madhumeha, and the modern medicine calls it diabetes mellitus. The words are ditto translation. They are word to word translation. Madhumeha translates to diabetes mellitus. So Ayurveda very well knew about diabetes, and it had a very scientific approach. Diabetes or Madhumeha part, Ayurveda has very clearly told Prameho Anushanginam, that is, the diabetes does not come to go away. It comes to stay with you. That is how it educates you to be very alert with the diabetes, and you have to lead the life of a very disciplined person. You have to be very careful with the diabetes so that it doesn't harm you. It doesn't lead to very grave complications. So as I told you, Ayurveda has classified diabetes as type 1, which is Sahaj, that is you are born with it. It is a kind of a genetic disorder, or it can be Apatya Nimittish, that is, it comes up as a lifestyle disorder or as an environmental disorder, which can more be linked to type 2. And Ayurveda very clearly told, type 1 patients will always be underweight and of a young age, which matches so well with type 1 diabetes, which is insulin dependent. And the type 2 patients or Apatya Nimittish Madhumeha patients will be overweight and will be having more strength than type 1 diabetes. And type 1 has been told by Ayurveda, that is, Sahaj Madhumeha was told to be incurable. No diabetes treatment was advised for type 1. It has been very, very clearly told, all the prescriptions, all the treatments for diabetes Madhumeha are meant for type 2 only. That is what Ayurveda has very clearly told. And prior to 1921, before the discovery of insulin, type 1 diabetes was 100% fatal. It was just not manageable, just not curable, just not treatable. 1921 onwards, when insulin was discovered, that is where type 1 patients could find some treatment, and now they could survive also. So Ayurveda knew so well about diabetes. By diabetes, Ayurveda has coined a term prameha, which are the metabolic disorders which present through urine. And the common symptom will be a lot of urination, a lot of micturition with turbidity. That is, voluminous and unclear kind of urine is the hallmark for all diabetes patients. So the symptoms Ayurveda mentions around 10,000 years ago are so well matching with the modern classification. That is where we can see the treatments could also be so much relevant. We have to explore more and more to find the relevance of Ayurveda treatments, which still are not available to all. We have to spread the word, and we can give an alternative to all the patients that they can manage their diabetes through Ayurveda. Now, what are the symptoms of diabetes or Madhumeha? The symptoms have been told by Ayurveda, which are so much matching. All the symptoms, causes, complications, everything matches very well with the modern description. The most important symptoms will be polyphagia. That is, patient will be feeling a lot hungry. He will be a lot thirsty. He will be drinking water again and again. He will be passing a lot of urine. And nocturia, he might be or she might be getting up in the night to go to a loo to pass urine. This can be the first indicator that you could be having diabetes if you have to get up in the night and pass urine. So polyphagia, polyuria, and polydipsia, along with weakness, are the presenting symptoms of type 2 diabetes. We'll not be discussing type 1 over here because we do not see many patients. Type 1 is altogether a different chapter. It is an autoimmune disorder which turns up overnight, which is very acute to come in, but we'll not be discussing that right now. The maximum patients we see are the type 2 patients, and which is very gradual to occur. And sometimes patient could be waiting for like 20 years and they do not know that they are suffering from type 2 diabetes. When they have got complications like diabetic retinopathy or diabetic nephropathy, that is when they come to know that, oh, they have been having diabetes for last 10 years or 20 years. So diabetes type 2 is very slow progressing disease. It all depends upon your sugar management. Will it be harming you or not? What are the complications? See, symptoms are not much bothering. If you are having polyphagia, polyuria, polydipsia, you can eat a lot, drink a lot of water and pass urine. The symptoms might not sound very bothering. What is bothering is the complication part. Diabetes will invariably be leading to blindness, renal failure, heart failure, nephropathy, neuropathy, and the retinopathy. These are the three commonest complications with the diabetic foot, gangrene, low immunity. Ayurveda has very clearly told that Madhumeha will be hampering your upper oja. Your immunity is bound to take a dip with Madhumeha. That is where you have to maintain your diabetes very well under control so that you maintain good immunity and you do not catch up with something like COVID-19. So after this introduction to diabetes, we go to what are the management principles. How do we manage diabetes or how do we manage Madhumeha? There are four things we route through: diet modification, lifestyle modification, some herbs, and Panchakarma detox. These are the four things we administer to all the clients. The most important are the diet modifications and lifestyle modifications. Herbs can be given, a few herbs can be given to control your diabetes and to boost your immunity. Panchakarma can be given for both the purposes, but diet modification and lifestyle modification are the most important. And that is where we have got with us Dr. Guru Datta, who will be demonstrating some yogasanas to us when I request him to come in. So let's take them up one by one. Maybe if anytime you have got a question, you might not be waiting till the end. You can anytime just stop me and put your question forward so that we settle it then there.
Sure. We are just at night one. We'll have to move along because Dr. Guru Datta has quite a bit of demo as well.
Right. Okay. So we move on to the four management aspects. What are the dietary modifications? The dietary modifications for a diabetic from Ayurveda are very unique. The patient should be taking small frequent meals. One should not be eating a lot at one time. He should be taking small frequent meals. The principle is Guru Aptarpana. He should be taking low calorie, high volume, complex carb diet. There have been many diet systems which have been tried, like a keto diet or a protein diet or pure carb diet. They all came and went away. They did not stay. They did not pass the test of time. So many diet approaches have been tried, but they did not succeed. The Ayurveda principles are very unique and they are very relevant. Guru Aptarpan, for taking low calorie, high volume diet, which will be comprising of like complex carbohydrates, bitter gourd, turmeric, black pepper, dry ginger, cinnamon, onions, garlic, a diet rich in all these. With these all have got proven scientific research papers as anti-diabetic. In USA only, there have been like thousands of papers with the efficacy of Ayurveda, and only cancer cure with ginger has been published under like 4,000 research papers in USA only. So all the world is exploring Ayurveda and we have to follow the principles. So the diet principles I review once again. Small meals, low calorie diet, volume which should be comprising of complex carbohydrates. Simple carbs or sugars are strict no. Then bitter gourd, turmeric, black pepper, dry ginger, cinnamon, onions, garlic are wonderful. That is your kitchen herbs or kitchen medicine, your kitchen pharmacy. You have to avoid overeating, chilled items from refrigerator, all the sugars, milk products and milk, alcohol and heavy meat. These are the things you should be avoiding. These will be depressing your metabolism and will lead to your uncontrolled blood sugar. Because diabetes from Ayurveda viewpoint is a metabolic disorder. That is why it is so much linked to obesity. Ayurveda links them very closely. Both come from Medo Dhatu, Madhumeha and Sthalya. Both are from Medo Dhatu. That is why both indicate fat metabolism abnormalities. That is where your diet will be a very important parameter. Now there are a few herbs which all have got proven scientific publications. There are thousands of publications for each herb. I'll be naming some of them. Charak has mentioned Amlaki and Haridra, that is gooseberry and turmeric as the best medicines for all the prameha, all the 20 types of prameha. So Amla or gooseberry, Indian gooseberry, then Kurkuma or turmeric, then Gugulu, Trikatu, Arjun, cinnamon, fenugreek, bitter gourd, onions and garlic, ginger and Gymnema sylvestra, Mahamajjak. These all are the herbs, single herbs which have got proven scientific value as wonderful pro-metabolic and hypoglycemic agents. So they really have got immense value and you have to combine them with your food and consume them as much as possible to keep your diabetes under control and to boost your immunity up. That is where we have formed a diabetic toolkit, So these herbs can be of immense use to you.
So maybe 1 second, Dr. Ish, you could explain, you have done clinical trial, as you said, and then maybe you can name which herb did you use for your clinical trial. I think that would be very useful for the users here.
Okay. Yeah. During my post-graduation, I had my first clinical trial with the diabetes mellitus where 60 patients were taken and they were given a very special combination of 5 herbs which were like a trifla, that is a Harad Baheda Amla, and two kind of Nisha, that is Haridra and Daru Haridra. These five herbs were taken from Yoga Ratnakar Grantha and these were soaked overnight and given to patient in the morning, soaked in the morning, given to patient in the evening. These were given twice in the volumes of 100 ml. 60 patients were divided into 2 groups and those were given Nisha Trifla Yoga and the others were given some placebo. And the results were really promising with the Nisha Trifla Yoga. It was difficult to take, being bitter, being 100 ml. Many patients reported that this was difficult to drink, but still it was very effective. That was my first clinical trial with diabetes. For my doctorate, for my PhD Ayurveda research trial, I again took another topic which was metabolic syndrome. For the metabolic syndrome study, I selected 100 patients, divided them in 2 groups of 50 each, and those were given again Trifla, Daru Haridra, Devdaru, and Shankpushpi, Sarpagandha, and Shilajit, along with Medohar Gugul and Dashmula Kwatha. The patients were given medicine in 2 groups like this, and this was the first Ayurveda clinical trial upon metabolic syndrome. It was completed in the year, I believe 2007. So that was the first clinical trial upon metabolic syndrome. And that is how these have been my very important clinical trials with the diabetes mellitus as a big study. Otherwise, we have been seeing patients every day. We are treating them every day. But the proper clinical studies were these two, Amitaji. Okay. Maybe I think we are not getting a connection from Amitaji. So maybe I move to the second component. We are done with the dietary modifications, and I will be waiting for your questions. Till then, I can move to the second part, where I will be, after some time, I will be inviting Dr. Gurudatta to take over. Lifestyle modifications. Lifestyle modifications are very, very important. Ayurveda has very clearly laid out what should be your dincharya, ritucharya. That is, what should be your daily routine and what should be your seasonal adaptations. How you should be living a daily life, and what should be your seasonal adaptation, so that you switch over very efficiently and you do not catch up diseases. Among dincharya, it has been told that physical activity is very, very important. If you are stressed, or if you are under some kind of depression or anxiety, then Ayurveda has very clearly told Vishado Rog Karanam. That is, being unhealthy at mind, being depressed or being dull or being under stress is very, very important, very big factor to invite diseases. That is where you have to remove your stress. You have to manage your urges, your physical urges, 13 physical urges, like you are hungry or you are sleepy or you feel like passing out urine on a stool. You should never suppress your physical urges. With respect to diabetes mellitus, you should never be suppressing your urge to pass urine. For example, someone could be feeling like passing urine, but this as a lifestyle, we do not give much importance to it. Okay, I'm feeling like passing urine, but I'll be passing urine after 1 hour or later on when I'm free. This is not a second priority. You should never be withholding, you should never be suppressing your physical urges. This will be imbalancing your tridosha and will invite so many medical conditions. And the diabetic person should especially never be suppressing the urges to pass out urine and stool. You should never suppress them. Physical activity is very, very important, which will be burning your extra blood sugar. It will be utilizing your insulin very well. That is where a lot of cardio exercise, a lot of dynamic exercises will be very, very important to work against your diabetes. Yoga, pranayam, and meditation parts will be demonstrated by Dr. Gurudatta.